that okay?
Mhm.
So we have Heather here today. She's an executive director for a nonprofit dance program. She's also a dancer. What do you want to look at today?
I've been having a lot of pain on my left side of my neck, my shoulder, like all the way in my shoulder joint and under my collarbone.
So turn this way just a little bit. And under the collarbone, here's the collarbone. So you get it on this side of it?
Yes.
Okay.
Yes.
Keep going. What else?
And directly behind that in my back.
Turn this way. So back in here?
Yeah.
Along the scapula.
Mm-hmm.
So she's pointing to the medial edge of the scapula, and there's a lot of trigger points I could feel right through the shirt right there.
Mm-hmm.
What else?
And then I'm having some sharp nerve pain in my left hip as well.
So she's pointing to the lateral aspect of her left hip, right around where the head of the femur inserts into the hip itself, into the pelvis, into the ilium. All right, let's get you on the table. Is there anything else, or is that a good start?
That's good. Sorry.
Okay, good. So I'm going to have you lie face down, and let's see, this garbage can's in the way. And you're going to scoot down enough so that your ankles hang off more. And you might have to readjust the paper, so pick your face up for a second, and pick your chest up so you can put your hands here. And let me reset you. Now lie face down again. That should do it. And the first thing I'm going to do is I'm going to do kind of more of a analytical style on you, because you have a few things and I'm curious what's showing up. Rather than just mushing you and squishing you, I'm just going to be a little bit more refined and seeing if we could really locate some of the spots that are not moving correctly. And how long has your left side been off? You know, left neck, left shoulder blade, left collarbone, left shoulder, and left hip.
It's been a few weeks, I'd say, like 3 weeks. There's a little discomfort in the area, maybe a little longer than that, but the pain has been 2 to 3 weeks.
Pain 2 to 3 weeks. Okay, so right now the first thing I see is your right leg is pulling short about 1.5 centimeters. When I bring it into position 2, they even. So that's telling me one of the iliums is out. Sometimes it's the knee, so I'm just going to take a quick peek at see if there's knee involvement. The knees are not showing up, so I'm going to leave them alone. I'm going to first push on your sits bone, see if that's the solution. It does not change anything. I come to the opposite side on the left and pull it down, and that does work. So we're going to do what's called an AS ilium correction, anterior superior ilium. I come just left of the second sacral tubercle. So the sacrum is a triangular bone. I can sometimes adjust it right down the plumb line middle of it, but I choose not to. In this case, I'm going to come slightly, like a centimeter left of center. I'm more towards the top because the second sacral tubercle is at the top of the isosceles triangle. The triangle is pointing down. And I'm going to put on a setting that's appropriate for the pelvis. And I'm going to push down like that. So that doesn't hurt, does it?
No.
Good. I hit it again because the first time I don't think I hit the landmark I was looking for. Sometimes I listen for the sound of it, and it'll make a sound like a dunk when it hits the way I want to. And if it's just like a light, superficial, fluffy noise, I'm not satisfied. Especially when it's something as strong as the sacrum or the ilium, the pelvis needs, you need to hit it accurately and you need to hit it cleanly. You need to hit the sweet spot. Now it came up to the iliac crest, and I found a nice landmark and I pushed it superior to inferior. Now I'm digging through the glute. I'm looking for the spine of ischium is the name of it. And that's kind of a ridge, kind of a little further up from the sits bone. And I'm trying to create a shift, because it's not just a 2-dimensional misalignment. It's actually 3-dimensional. There's a rotation or a torque. And right away, we do have it balanced. But I'm not satisfied there. I'm going to check it in position 2. I'm going to bring it all the way up to position 3, re-look at it, leg starts to go short again. That means her sacrum perhaps is superior. I'm going to just test it with a little pressure test. That seems to work perfect, so I'm going to work on that. I'm going to adjust. Now I'm on the center of the sacrum. I'm getting right down the middle. I'm adjusting from superior to inferior. Now let's go look at it again. Balance in position 2, in position 1. Balance in position 2. I bring it all the way up to position 3, and it's balanced. Let's just do one last thing where I just pump one leg and let's pump the other leg. And that is checks for sacrum laterality, and that's fine. Put your right wrist on your lower back, please. So you just clunk it up there. Yeah, just like this. And that checks for L5, and she does have some L5 involvement on the right side. So even though she has pain on the left, sometimes we chase the symptom, but a lot of times we're chasing the alignment first because you don't know why the left side's more symptomatic. Some of the faults could be on the right, and then the left side counterpulls. And here's another one. I'm just coming up because I felt something in palpation. I trust my palpation a lot. So even though I know all the technical, paint by numbers techniques that I've studied, I also really trust my fingertips. So let's see. Okay, so now put your right wrist on your lower back. And now switch arms, please. And now put both wrists on the lower back. And both arms to the top of the table. And legs are staying even. Both arms back down. Turn your face to the right, please. Leave it there. Any tightness when you turn to the right in the neck?
A little bit.
On the left side or on the right side?
On the right side.
Point to it. She pointed up high on the neck. There's a lot of hair there, so I'm going to try to move some of it out of the way. Put your head straight down. So I felt it right there. Do you?
Yes.
So right now I'm on C2. I'm going to adjust it kind of on an angle towards the nose. So I'm coming up, medial towards the nose. Turn your face to the right. See if it feels any different.
Yeah, it's different.
Is it better or just different?
It's better. It's still a little tight, but it's better.
Okay, so point to where you still feel it. Do you feel it the same exact spot or did it shift?
Right here.
Good. So she pointed just slightly lower. She's on C3. Back to center. She's very close to the spinous, so I'm going to come in tight and now try that again. So we're kind of chasing it a little bit. What do you think?
It's a lot better.
Okay. Mm-hmm. Is it still there though? Let's.
It's maybe a little lower.
Okay, so we're really chasing it at this point. Now she's doing C4. So I'm going to jump ahead. I'm going to do 2 points on this. Back to center because I see where we're going. So I'm going to just drop down. I'm going to get the lower cervicals. And then I found this big trigger point right here. How much does that hurt?
A lot.
So I'm going to come right into there. And it's funny because we're on the right side right now. Mm-hmm. Her complaint is left. But turn your face to the right. And how does that feel?
Much better.
Much better. So now go to the left. Now I veered, as you can see, I veered off the technique, the classic technique, and I'm kind of jumping ahead because I want to just get to the bottom of this rotation. Now this is, I don't even have to ask her because this is a crazy trigger point. Do you feel how horrible that is?
Yeah.
That's very painful, right?
Mm-hmm.
So I'm just going to adjust into that trigger point. There's a rib underneath it. Back to center. Now this time when you turn left, observe where you feel tightness. So turn left. And where do you feel it?
All of them.
Yeah, so we're going to do a little chain again. So back to the center. I'm going to start at C2. I'm just going to come down. I'm on a very light setting for the cervicals. And turn left again, please.
It's still pretty tight.
Okay. Point to where it feels worse. Where's the epicenter of the tightness? Good. Back to center. I'm just going to come in a little bit more lateral to medial. Try it again. Getting there or no?
It's getting there.
This whole left side's a mess.
Yeah.
And I'm going to do a good job on it today. My goal is like that by tomorrow you're like 30, 40% relieved. Mm-hmm. But you're going to need another treatment if you choose to. Mm-hmm. Because yours is bigger than a one treatment neck.
Yeah.
I wish it wasn't, but you knew that anyway, right? It's pretty jacked up. So back to center. And I'm also going to come into right at the base. Now turn left and just see if it's starting to move a little better.
A little better.
Okay.
It's really tight here.
All right. So the next thing I'm going to do is adjust that by hand. But I do want to look at that left hip pain that you mentioned. So let me check rotation on your hip. So I'm going to swing your hip out. And it is. So you have a internally rotated left hip. And it's pushing anterior. So pick this hip up in the air. So I'm going right under the head of the femur where it comes in and pushing straight up. And that might take some pressure off that nervy pain that you're feeling. It balanced the leg. So now lie on your back, please. Good. I'm going to take that paper away. So lean up a little bit. And then slide all the way back on the table. So the first thing we're going to do is adjust your neck by hand. You have more stuff on the left, but I really want to start on the right. Is that okay?
Mm-hmm.
Good. And then we're going to come, trying to feel where the word, that's pretty bad right there.
Mm.
Now turn your head left and right. What does it feel like? It's getting closer, right?
Mm-hmm.
So I know you have some collarbone stuff. I'm going to do your collarbone, shoulder blade, and shoulder all at the same time. I'm going to have you move close to me. I'm going to lower the table a little bit so it's the right height for me. Even more, so you see how your shoulders in that little crevice? So you're going to lightly keep your hand up here. I'm going to grab into your arm, but also with my pinky, I'm going to kind of stabilize the clavicle, the collarbone. I'm going to put my hand underneath by the scapula, but I'll just be between the spine and the medial aspect of the scapula. I'm going to pull this across. So you're going to keep your palm down right here. And didn't pop, but I got it to shift a little bit. Now I'm going to double up on it, come back kind of in the same area. And that one you felt. Good. So now lie on your side facing me. Is it hard to move?
It's pinching in my thoracic.
Okay. Where do you feel it? Up in here? Is it still pinching?
More in the spine. Yeah.
Up in there?
A little higher.
Okay. How about there?
Slightly lower. Yeah.
It's like a little muscle spasm, right?
It was like between the vertebrae.
All right, so just rubbing that out a little bit. All right.
And that's where I've been feeling the tension.
That's been one of your bad spots?
Mm-hmm.
Okay. It just released, so let's see if that helps a little bit. I'm going to bring your hip towards me. That feel okay?
Mm-hmm.
All right. Come to the other side, please. And scoot towards me.
Sorry, I'm having sharp pain right in there.
And is this the type of pain that's been happening?
No.
It's a new one.
Yeah.
Okay. So
It's
come,
sharper and it's referring down my arm.
okay, so come stand up. And come turn around towards me. And which way are you feeling it now?
Right here.
Okay, so come turn this way. Is it in the middle or slightly left?
Slightly left.
Right there?
I mean, that hurts, but when I'm feeling the sharp pain, it's more like really close to the vertebrae.
Okay.
Right in there.
So turn this way a little bit. Right in there?
Yeah.
So I'm going to use just the tapping instrument on that, okay? So I'm going to have you lie face down. Let me give you another piece of paper. Put your nose there. So I'm going to put it on a very light setting. Do you feel it right there, close to the spine, or a little higher up?
Right there.
Right there, okay. And come up one higher too. So turn your head left and right, see if it's pulling there anymore.
No.
Did it ease up?
I think so.
Yeah.
It's kind of when I move a certain way, so I guess we'll see when I roll over.
Okay, let me just. I'm going to put it on the very lightest setting and just lift the spinous a little bit. The spinous is a little tilted, a little compressed. Okay, you want to? So your experiment is turning over?
Mm-hmm.
Okay, try that. What happened that time?
It feels fine.
It feels fine?
Yeah.
Okay. So That side's done. So you
Oh,
can
okay.
come sit up.
Okay.
So come stand again and just move around a little bit. See how you feel. Maybe lift your arm.
Yeah, it's a lot better.
Okay. So it's a rough one, huh?
Yeah.
All right. So turn your head left and right. What part feels better? What part doesn't? Like, do you notice anything in the left hip right now?
No.
Okay. And then the left shoulder has been nasty for a couple of weeks.
Mm-hmm.
Does it feel worse than you came in? You can say, I don't care.
No, it doesn't feel
Yeah.
worse. It doesn't feel worse. I think there's some things that have shifted. Like I'm definitely feeling like right in my thoracic spine a little like insecurity.
Okay.
Like lateral stretching feels a little painful.
Okay.
But
Does it
also
feel
feels like
worse
it needs
than you
to just
came in, or
relax.
does it feel like we did something?
No, it doesn't feel worse. No. It definitely did something good. Yeah.
Okay. And how's your neck? Because that was the other thing. Your neck was really tight.
Yeah, it's a lot better.
Okay, cool. I mean, this is kind of good because, working, and she's a high level dancer, working with someone, they come in with different issues. Some things get better, some things stay the same. I'd love to say that every time I touch someone, they have a miraculous healing, but that's actually not true. Someone like Heather, I just met her today, but someone like Heather might, decide, hey, I'm going to do a couple of visits and see if we can work out some of these problems. One or two of the problems, let's say the left hip, one visit, it's gone. But the left shoulder has been something that's been a problem for her, and that might take a few visits. It might be a little more achy tomorrow. Not sure. And then she might choose never to come back. That's okay. But she also might go, okay, now it's feeling different, but I feel like it's healing perhaps. She comes back in a day or two. We do another session. We do another layer, and they compile on each other. I once had a professor that said it's like putting out a bonfire on the beach. You take a bucket of water. The first bucket does not bring those flames that are 2 meters high down much. But then the second bucket, third bucket, fourth bucket, you finally see the flames coming down. And that happens with injuries sometimes, where you don't feel like you get much done, but then after the second or third treatment, it starts to really simmer down. And the fourth or fifth treatment, it's basically gone again. So you'll have to decide what you want to do next.
Mm-hmm.
But I think we did enough good stuff to take the pressure off of it, and we'll see what happens.
Thank you.
All right, thanks.